Every mother-to-be wants her pregnancy to be a time of happy anticipation, yet a fear of preeclampsia may prevent her from enjoying it. Preeclampsia is a potentially life-threatening syndrome that involves several organ systems and manifests itself during pregnancy or up to 6 weeks postpartum. It is the main cause of mother's illness and death. It also has long-term implications. Mother's preeclampsia poses a serious threat to the child's life and health as well. In Estonia, the frequency of preeclampsia is 1 in 50 pregnancies. Every 200th pregnant woman develops preeclampsia before the 34th week of pregnancy. In the heart of preeclampsia is the abnormal attachment of the placenta to the uterus, where the connection between the circulatory systems of the mother and the fetus is inefficient. The rapidly developing fetus needs to receive oxygen and nutrients from the mother's bloodstream in order to grow. With placental hypoxia, toxins are released into the mother's circulatory system, damaging her blood vessels' endothelium, followed by systematic damage to the mother's internal organs. In order to save the mother's life, the baby needs to be born. If this happens in a very early state of pregnancy, the child may not be mature enough to survive. Symptoms associated with potential preeclampsia include severe headaches, nausea, changes in vision, pain in upper right abdomen, shortness of breath, infrequent urination, swelling, and rapid weight gain. Although all pregnant women may develop preeclampsia, some women are more threatened by it than others. High risk does not mean preeclampsia will definitely occur, but the results of the screening help the doctor and the patient recognize the potential early signs of preeclampsia. Preeclampsia screening involves 3 screening tests that define how high the risk is, followed by a plan of action for the future. The more advanced the pregnancy is, the more accurate the estimation is. Preeclampsia screening increases confidence in all patients, but most importantly, those who are in the high-risk group because of various health conditions. Preeclampsia screening increases confidence in all patients, but most importantly, those who are in the high-risk group because of various health conditions. If the Oscar test in the first trimester reveals a heightened risk, low-dose aspirin treatment can support the development of placental blood vessels. In the second trimester, preeclampsia risk is recalculated and the efficiency of low-dose aspirin treatment is evaluated. Monitoring continues in the third trimester. In case of very high risk, with an extra screening test in the 32nd week. Preeclampsia screening consists of a nurse's visit and an ultrasound conducted by a gynecologist. The nurse interviews the pregnant woman and measures her blood pressure, height, and weight, as well as conducts a blood test. The gynecologist performs a fetal ultrasound and measures the blood flow indices for uterine arteries that supply blood to the placenta. Combining the values of hormone levels in the blood analysis with risk factors, blood pressure value, body mass index, and blood flow parameters for uterine arteries, the gynecologist calculates individual risk estimations for early and late onset preeclampsia using a special computer program. The 3-stage preeclampsia screening provides an opportunity to prevent preeclampsia or delay its onset towards a later stage in pregnancy. Management of pregnancy risks, as well as thoughtful science-based monitoring and treatment, give both the mother and child much-needed confidence. This way, the child can be born safely at maturity and the mother can rejoice on having a happy and healthy baby.